Hello, everyone. Welcome to the brief class called Disaster Health Services for Event-Based Volunteers and Community Partners. We abbreviate that to be DEBV, which is Disaster Event-Based Volunteers and Community Partners. My name is Kathy Gordon. I am the Regional Disaster Health Services Lead for the American Red Cross. I am a volunteer. I've been a nurse practitioner for a long time, and I'm also a nurse midwife, but that has nothing to do with this class. Just giving you a little of my background. The course was developed to introduce currently licensed or certified health professionals like yourselves to the Red Cross standards, policies, and procedures that guide the delivery of disaster health services to clients. Disaster health service is a core service offered to both disaster health clients and Red Cross workers like yourselves assigned to disaster relief operation. Since its inception in the early 1900s, Red Cross DHS has been an RN-led community health model of service delivery. Besides nurses, which includes APRNs, RNs, LPNs, other health workers may include physicians, physician assistants, paramedics, and EMTs. While RNs can work up to their professional scope of practice, Red Cross DHS policies and practices do limit the type of clinical intervention and other health-related activities that disaster health services workers can actually perform. Whenever in question, please consult your supervisor assigned to you. So let's move on and introduce you to what you will be doing as a disaster DEBV or CP. I'm so glad you're here. So at the end of today's training session, you should leave with the following principles: a better understanding of the various Red Cross service delivery sites, including shelters and other community settings, the range of Red Cross services provided at these sites, and the opportunities for disaster health services collaboration. You'll also be able to distinguish between health services provided in the disaster Red Cross settings and those in traditional healthcare environments. They are different, and they are common. You're going to identify some common health issues and conditions typically seen in the aftermath of a disaster. You're going to understand the key responsibilities and tasks for Red Cross disaster event volunteers and community partners and the Red Cross disaster health service workers in support of the clients and staff. And finally, some information on how to prepare your role as a DEBV and CP volunteer. So, since the founding of the American Red Cross in Dansville, New York by Clara Barton on May 21, 1881, the Red Cross has been dedicated to serving people in need. Clara Barton was a nurse, if you don't know that. In 2025, the Red Cross will celebrate 144 years of compassionate service here in the U.S. At the core of the Red Cross domestic service to the U.S. is its mission to prevent and alleviate human suffering in the face of emergencies by mobilizing the powers of volunteers like you and like me and the generosity of donors. All Red Cross societies across the globe embrace the seven fundamental principles: humanity, impartiality, neutrality, independence, voluntary, service, unity, and universality. All Red Cross disaster health relief organizations are executed using an incident command structure. We abbreviate that by saying ICS. While the Red Cross ICS deviates a bit from traditional ICS, the spirit is the same. This graph represents the DRO structure for a large national operation, which we define as a level 4 or greater. In many states, Red Cross is the official partner working in collaboration with state and local authorities and community-based partners to set up general population shelters during disasters. Clients seek out shelters when evacuating out of harm's way in the days and hours prior to disaster striking and in the aftermath of a disaster when their homes are damaged, destroyed, temporarily unlivable, or unreachable. Red Cross DHS workers and other community health partners meet client health needs in shelters and other service delivery sites such as a multi agency resource center, a disaster recovery center, an emergency supply distribution site, and on community mobile outreach teams. Disaster Health Services also provides health services for the Red Cross headquarters and other sites where staff are deployed. Other Red Cross client-facing support services include mental health, spiritual care, disability integration, casework, and shelter resident transition assistance. If you are assigned to work in a shelter, please remember to always sign in and sign out when leaving the shelter so that the shelter manager knows if you are there or not. It is very likely you will be assigned to a shelter in a Red Cross or partner shelter. Shelters may vary from community to community in the following ways: the size, the accessibility and accommodations. Most won't have the creature comforts of home, but we're going to do our darndest to do what they did at home right here. Location, in particular, some may not be in close proximity to healthcare facilities, urgent cares, or other places where individuals seek medical treatment for acute or chronic condition. They could be rural. Depending on the shelter, limited medical supplies and equipment may be available. Most shelters do have a shelter kit containing basic first aid supplies. AEDs may or may not be available. If you are missing critical supplies or equipment, please contact your disaster health service supervisor or manager. If unavailable, seek out the shelter manager for assistance. In the previous two slides, I referenced the shelter manager and the DHS manager and supervisor. Just as all disaster relief operations from an incident command structure, so do most service delivery sites, such as a shelter. This slide provides a graphic of Red Cross shelter management structure. It is important to note that you will have a functional supervisor who is the individual supervising your DHS-specific activities, such as providing clinical supervision, as well as administrative supervisor, which is in the individual in charge of the setting you are assigned to, such as the shelter manager or shift supervisor. For issues or concerns within the shelter environment, please see the shelter shift supervisor or shelter manager. For specific disaster health issues or concerns, please see your disaster health supervisor or the headquarters disaster health manager. As you might assume, providing health services in a disaster setting is likely going to look very different from where you work and provide day-to-day care for your patients. Here you can see some of those differences. As a DHS, DEBV, or CP volunteer, the majority of your health service activities are likely to be more like public health in nature than high clinical level intervention like in a hospital setting, particularly within the shelter. In shelters, health services workers are likely to see acute injuries and illnesses, minor scrapes, cuts, bruises, etc., general stress-related symptoms, aggravation of pre-existing chronic health conditions. You also might see things like an exacerbation of a mental health need because they don't have their medications available or their anxiety has increased due to fear of more tornadoes. It is not uncommon for clients to forget their medications, to forget to disclose certain healthcare conditions which you may inadvertently discover later. And maybe they don't even have a PCP or are cut off from communicating with their primary care provider due to network downs in the disaster. Some shelter residents may come from home and may have home health caregiver or a family caregiver. Others may actively be in hospice, dialysis, or require personal assistance for their activities of daily living. While all such clients are welcome in the shelters, you will need to assess the health-related needs carefully, determine where additional resources or higher level of care is needed, and then work with your supervisor and the community-based partners to meet these clients' complex needs. We know that you're capable of that and you know the best about your community. Bottom line up front, the majority of the client healthcare needs can be met while staying in a shelter. Disaster health services will refer clients to a higher level of care if needed. If you're working with a client and believe they require a high level of care, that more than what can be provided in a shelter, please alert the supervisor as soon as possible. If an emergent situation arises, call 911. We trust your decision. This slide provides a high-level overview of the primary responsibilities of a disaster health services DEBV or CP worker. At the top is to ensure that you are doing everything possible to protect the confidentiality and personally identification of that client. Although Red Cross is not HIPAA entity, we still have an ethical responsibility to protect the privacy of our clients. We also try to support clients being responsible for their own recovery and decision making when at all possible. We support clients by assisting them with applying strength-based coping strategy, psychological first aid to address their day-to-day recovery challenge, reaching out when they need assistance and encourage them to advocate for their own needs when and where needed, and or advocating on their behalf when they are unable to do so. While the last slide provided a high-level overview of your responsibilities as a disaster health DEBV or CP volunteer, this one provides a bit more specificity with what it may look like to provide client-facing disaster health services in a shelter. The following represent key client health tasks and activities you may need to do in a shelter: conducting health assessment and ensure care for clients, evaluate every client's health and ensure access to care for disabled, disaster-related, and unmet needs. We assist clients with blood glucose, blood pressure checks, dressing changes, and with client assistance, health education to follow up in the medical regimen as directed by their provider. If clients need a clinical diagnosis or treatment for a specific health condition, we will refer them to a higher level of care, such as community health clinics, urgent cares, or emergency departments. For all life-threatening situations, we call 911, just like you do. Assess and ensure activities of daily living support. Assist the clients with assessing needs to support those activities of daily living, providing light personal help when necessary. However, if a client requires significant assistance with anything else or cannot self-administer their own medication, let us know as your supervisor. We procure medical supplies. Most shelters will have a shelter kit with minimal first aid supplies. However, if you need additional items or equipment than what is provided in the shelter kit, please see your supervisor. When necessary, obtain over-the-counter meds, durable medical equipment to support their needs and their access and function, or other health-related supplies by contacting your supervisor. Coordinate with the leadership. When providing disaster health services in a shelter, it is important to adhere to the Red Cross policies and scope of practice guidelines. Follow the direction of your Red Cross leadership and, when necessary, engage with the local, state, and public health authorities. Implement infection control. Apply and monitor infection control measures in line with Red Cross and public health guidance. Report illnesses and incidents. Escalate any reportable incident or illness to the disaster health service supervisor and or to the shelter manager, so in turn they can be reported to federal, state, or local authorities as required. Medications are the property and the responsibility of the client. DHS responders do not dispense or administer medications. I almost always tell our new volunteers, we're not going to fill a med cart and go down the rows cot to cot and administer medications like they do in a nursing home, for example. It's the client's responsibility. Clients must ensure their medications are in a secure container, out of the reach of children and other residents. Special medication storage requirements should be followed below and brought to the attention of your supervisor and shelter manager. If it is not safe for clients to leave their medications with them, medications can be placed in a paper or plastic bag identified with the client's name. Medications must then be locked or secured under the supervision of the shelter staff or the disaster health services team when they are in the shelter or on a 24/7 day basis per week. When clients need to take their medications, they request the bag from the shelter. Shelter staff may also make over-the-counter medications available to client when DHS responders are not available, such as Tylenol. Shelter staff should be trained to ask, "What particularly do you take? And let me see if I can help you." Give the client the bottle or package of the over-the-counter medicine and ensure they can read and interpret the instruction. The client determines and self-administers that appropriate dosage. Health workers may assist a client with counting out an individual dose so that the client can self-administer at a time. Do not offer clients a multi-dose bottle of medication that could result in the client actually providing other clients with the same meds. If additional doses are not available, workers must wash thoroughly their hands and utilize a medicine cup for each dose. Make sure the bottle of medication is not contaminated as well, never left out of sight. It is advisable to work with the client to establish a log to track their self-medication of the over-the-counter meds. Disaster health workers have minimal record-keeping responsibility. Because disaster health, DEBV, and CP workers do not have the same access to Red Cross record-keeping systems, they must work very closely with each other, with the Red Cross disaster health workers, to document and report the appropriate health illnesses, injuries, and other conditions. As a rule, minor health issues such as treating minor illnesses and injuries, headache, upset stomach, a scrape, a bruise, do not require documentation. The following injury, illnesses, and other significant health conditions may require documentation and the reporting to the appropriate Red Cross leadership and/or federal, state, or local public health officials. A significant injury or illness requiring referral to a high level of care, such as an urgent care or an emergency department. Any injury that occurred in a Red Cross setting that may result in an insurance claim. Critical health conditions requiring life-sustaining and other stabilizing measures and/or EMS response. Illnesses or injuries that require federal, state, or locally mandatory reporting, such as child abuse, elder abuse, animal bite, highly infectious disease. Trained Red Cross disaster health workers may be required to log the above conditions into a specific Red Cross system, such as Dharma, RC Care, or Skya. Please work closely with your supervisor to understand documenting and recording requirements. This is a copy of the client health record to help document significant health interventions. It's actually an electronic form that can be printed out, so you can handwrite or you can document directly off the computer and then save a copy of it to the specific disaster relief operation files for disaster health services. When using this form, please ensure your selections are clearly noted and any written comments are clear, concise, and legible. Work with your supervisor to determine how to use this form and how it will be stored in the appropriate Red Cross system of record. So while caring for clients, we also care for our own. Red Cross typically deploys disaster health service workers. DEBV and CP workers may also be tasked with providing health services workers they encourage in their work settings, such as shelter workers. As with a client, you would assess the worker's immediate health-related needs, ensuring you call 911 should the worker require any life-saving immediate care. Workers with non-acute, pre-existing health conditions that may be exacerbated by disaster conditions should be referred to their primary health care provider for consultation and advice on how to address their symptoms. If the worker's physician or healthcare provider suggests seeking immediate care, you will assist the worker on obtaining that care. Finally, if the worker is experiencing acute healthcare need requiring a higher level of care, or if it interferes with the ability to work, or if it creates an unsafe environment, potentially an infectious disease, for example. For clients and or workers, you should work with your supervisor to determine the most appropriate intervention and complete the illness injury report as directed. A picture of that report can be found on this next slide. This injury report is only used to document Red Cross worker-related illnesses and injuries. The Red Cross worker may be a volunteer or they may be employed. The form is available electronically. You won't have to worry about documenting it, but we will do that for you. We just need you to tell us to document it. Let us know. Well, let's talk about your role with staff health and some of the key tasks that we actually perform. So we are performing, and you can help with this, conducting a health assessment, ensuring appropriate care for any staff that may be injured or sick. Coordinating with the disaster workforce group and appropriate leadership. And what I mean by that is if let's just say one of the feeding volunteers fell and broke their ankle, we need to make sure their supervisor knows and their manager knows and the workforce knows that we now have someone off and out and maybe even going home, so that we can make sure we, number one, fill the need and take care of them as they go home. So it's very important that if you're involved with that, be sure that this goes up the level of channels and leadership command so that people get notified of that. Red Cross health workers with access to the Red Cross systems of record must be consulted anytime of the following activities. A client with healthcare needs that are very complex, which may require monitoring or tracking over time, such as glucometer monitoring. Conditions that require escalations to a higher level of care. Sometimes people need to be moved out of the shelter to a higher level of care. Clients needing health services financial assistance. Let our team know that. Injuries, illnesses, or other health-related issues that require mandatory reporting. We want to know about that. Any situation that raises concern for clients or staff safety or for care that isn't being already assessed. Clients requiring assessments in our program called CMIST, and that is assessing for functional and access needs within the shelter. To a higher level of care. Sometimes people need to be moved out of the shelter to a higher level of care. Clients needing health services financial assistance. Let our team know that. Injuries, illnesses, or other health-related issues that require mandatory reporting. We want to know about that. Any situation that raises concern for clients or staff safety or for care that isn't being already assessed. Clients requiring assessments in our program called CMIST, and that is assessing for functional and access needs within the shelter. All right, well, let's prepare you for your role as a disaster event-based volunteer or community partner. Let's make sure we set you up for success. First of all, blessed are the flexible, for they shall bend and not break. Flexibility is a key component. Sometimes you have to wait to speak to somebody because there's a lot of people trying to solve problems, but we can do that. We can be active listeners and listen to what the client is saying or what your healthcare services people are saying so that you are successful in the next steps. Being incredibly respectful. It's hard when we're facing a disaster because there's sometimes a lot of escalated voices and urgencies that we can just be kind and respectful and finally meet. Compassion. Show empathy and compassion for others in every aspect of your engagement with clients and workers. Collaboration. Strive to work well with others and achieve the goal. How can we get to the yes, especially with the client? Be willing to pitch in and help where needed. I can do that, even if it doesn't strictly align with the work you're expected to do, like distributing water. distributing snacks, serving meals, keeping your workspace clean, maybe keeping the shelter clean. And be creative in problem solving, finding innovative solutions to challenges. The availability of resources and services can be severely limited in the aftermath of a disaster. Use your creative problem solving skills and those of your colleagues to help meet the needs of those clients and workers. We that are not part of your community rely on you to help us better understand your community. So freely give those suggestions and think big, think creative and innovative. So, how can you be engaged with the Red Cross and your eligibility? Um, when disaster house services workers are engaged and assigned relief activities are covered by Red Cross corporate insurance program for their liability and malpractice when the worker is engaged in actively covering and controlling the supervision of a Red Cross employee or volunteer. You're part of this. You are part of our volunteers. When you engage as a DEVBV by signing in and getting a volunteer connection number, the house services worker adheres to Red Cross and Disaster House Services procedure while engaged in the activity, and they do not act in illegal, unethical, or grossly negligent manners. House service workers are not required to provide their own professional malpractice insurance companies, but you are required to have a current certification in basic life support, CPR, and licensure. Again, here's the professional liability protection. You are not required to have your own professional liability malpractice insurance coverage to participate within the Red Cross activities. All right, everybody, we're almost done. Let's talk about what you can wear and what you can bring. Red Cross workers do not wear any specific uniforms and typically wear business or very casual clothing. Shirts and other clothing with religious, political, or other messages or images wording inappropriate for the general public are prohibited. You can ask your supervisor if there are any Red Cross vests available, or you can wear your own Medical Reserve Corps vest or ID. You should also wear a name tag with your name, first name only is okay, and your professional credentials so that we can address you properly and know your skill set. Closed-toed, comfortable shoes are also highly recommended. Taking care of yourself while on a disaster deployment can be challenging at best. In our profession, we also find ourselves putting the needs of our clients before ourselves. Isn't that so typical? Because disasters are inherently stressful events, it is important that you be self-aware of your needs and take care of yourself. As you go into this role, please note the following. Know your own strengths, weaknesses, and vulnerabilities and triggers. When you are stressed, take a short break as needed. Make sure your supervisor knows when you are leaving your post. Connect with disaster mental health or spiritual care if you need their support. Request assistance during difficult conversations. Ensure you get adequate sleep. Ensure you're drinking enough water and eating. Take your days off if you're on a multi-day assignment. Utilize your resources as well as your fellow workers and volunteers as much as you possibly can. So take a moment and look at this scenario. The shelter registration worker alerts you that a couple registering for the shelter have shared the woman is undergoing chemo for cancer. The couple are told house service workers must speak to them before they can complete registration process. As you identify yourself to the disaster health service volunteer, the husband comes up to you and says in an angry voice, "Does this mean we can't stay here? We have no place to go." As you begin the conversation with the couple, what would you do to ease their concern? I'm going to pause a little bit so you can think about it. Think about what you would do to ease their concern. And keep in mind our mission. You're going to find them a private area to speak to the couple. You can offer the woman a mask. How can we best help support her care in her chemo and keeping her safe and free from maybe picking up an infection? Perhaps temporarily residing in close quarters with many people in different stages of health and no private bathroom is a concern. Find out where she's receiving chemo, how often she receives it, when her next scheduled appointment is, and when the clinic is open. Inquire about if they need transportation. Do what you can to make them feel rest assured and that we're here to help them. And then also alert your shelter manager. If the clinic that she goes to is not open during the disaster, find out what her PCP recommends. Help the client with any needed dietary restrictions or desires. Confirm that you will be working with them to assist them and remain safe, and when you are not there, who they can go to for help. If there are any special dietary needs, discuss this with the shelter manager. We will do our best to make efforts for them. If they don't have transportation, arrange for support meals to be picked up locally. Stress hand washing to clients, to staff at shelter meetings. If norovirus or respiratory virus symptoms are identified in the shelter, have the client contact her PCP immediately to be aware of the situation. Work with your supervisor to address any special proactive strategies that can be taken into consideration with this client, such as wearing masks. Assume the husband is the caregiver and provide respite options, but make sure that that's indeed his role. Identify options to assist the clients with ADLs and other support as necessary. Determine also if the husband has disaster-related needs. We do need to care for the caregiver. Refer to mental health or spiritual care if necessary and desired, and document appropriate health services and client health record. Okay, friends, we are almost done. So what are your next steps? What do you need to do? Who do you hear from? The timeline? How do you sign up for shifts? Your current connection is here at the headquarters, and they will help you. Or the regional lead for this area should reach out to you in the next couple of weeks. We're going to say in the next few minutes, and talk to you about your experience with the Red Cross and get you all of that information. It is coming as we speak. So we have gone through these objectives to better understand the various Red Cross service delivery sites, including shelters and other community settings, the range of Red Cross services provided at these sites, and the opportunities of disaster health services collaboration. We've talked about the ability to distinguish between health services provided in Red Cross settings and those compared to traditional health care settings. We know how to identify some common health issues and conditions typically seen in the aftermath of a disaster, and the key responsibilities and tasks for Red Cross disaster event-based volunteers and partners and community disaster health service workers in support of clients and staff. And finally, some information on how to prepare you as a DEBV CP volunteer. I just want to say thank you for enduring this video, and I can't wait to meet you, and I am so excited to have you partner with us. I look forward to it very soon. Thank you so much.